Dr. Brandon Buttry of OneHealth Chiropractic here. I want to share a diagram with all of you that, if understood completely and properly, will make a lot of sense as to why chiropractic takes more than just one visit to get things better and to keep things better. So observe this. The first line that we want to take into consideration is what is called the optimal health line. This is where everybody starts. When you're a kid, pretty close to that line. That is 100% functionality, 100% health. From that point on, we enter the world, we start trying to walk, and we fall a lot. And then we learn how to play on the playground, and we fall some more. And we start playing with our friends and wrestling with our friends and falling more. And then we start playing sports, middle school, high school, start having to study more, and then we have bad posture while studying, stress from school. Maybe you have yourself a little side job and you're working hard at your job. Then through college we're working. Through college is even more stress, more tests, more studying. Maybe you're working out at the gym. Maybe you're hiking, biking. Maybe you get yourself in a car accident, God forbid. And you continue on, you have kids of your own, you get a job in the real world, you start working harder and harder, more hours, more stress. Wife at home, kids, not sleeping well. Then add the car trips, the plane trips, road trips, and eventually, at some point, you end up down here in what we would call, if we draw the second line, all of these things add up, taking you below this second line into what we simply call the pain zone. This is where you are feeling symptoms, headaches, numbness, tingling, sciatica, digestive issues, acid reflux, chronic tendonitis, whatever may be ailing you, whatever symptom it may be, happens down in this area. Maybe it's not the pain zone, maybe it's the symptom zone. Maybe this is where muscles are starting to get really tight and become dysfunctional or weak. Whatever it is not the result of sleeping wrong for one night. It is a result of lifestyle-induced trauma bit by bit. And then you slept wrong and it took you over the top and into the pain zone. Now, that's all well and good of how we get there, but what everybody always wants to know is, how do we get out of there? Can we ever get back to the optimal health line? Well, that depends on a few different factors. Age, overall level of health, condition of your spine on the x-rays, what the doctor finds in the exam, all of these things. See, what you're doing at work, what you're doing for hobbies, all of these things are factored into what your ability will be to get back on that line, and or how long it might take. And so the doctors here at OneHealth will assess that and come up with a number that's required to get you as close to that line as possible, and then what? Keep you there for as long as possible. So we do our adjustments, boom, 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 to get you as close to that line as possible, and then show you how to keep it good into the future. What a waste it would be to do all this work and then let it all go in the toilet again. No, the goal of a workout program is to get your body in shape and then keep you in shape. For how long? For as long as you want to be in shape. The goal with the spine, since it protects valuable tissue that is irreplaceable, i.e. the spinal cord and the nerve roots, which branch and branch and branch and eventually feed all the tissues in the body, the idea here is to rebuild the motor, rebuild the spine, and then just get oil changes. Just get regular tune-ups for your spine. See, the spine's always under pressure, just like teeth will always build up plaque. And if the spine's always under pressure, and then you're exercising on it, you're working on it, you're doing yard work on it, you're picking up your kids without proper form on it, these things just compile and add and start to produce more symptoms. And so as we build you up, we have several options on how you can stay at a high level of health, because that is the ultimate goal in this office, and that's the ultimate goal for every patient that I have, and hopefully that's the ultimate goal for you. This area between the two lines is a very interesting area. This area through here is what one might call the area of dis-ease. Dis hyphen ease. Do not confuse this with the word disease. This is dis-ease, which simply just means lack of ease. Do you want your body to have a lack of ease, a lack of coordination, a lack of function? No. No. The problem with this area between these two lines is that many times people, quote, feel good or feel okay, or they're just toughing it out a little bit. It's not that bad. The problem is this is a state of functional dysfunction. This is where 99% of the people are living right now today. And we only go and get help for our health after we've crossed into this line into a place of turmoil and despair and pain and symptoms, and then hope for a miracle. What we strive to do is, yes, if you're here, we'll get you out of there, no problem. But then we want to educate the masses on why it's so important to stay as close to that optimal health line as possible. Because we don't want people limited in their function. Because limited functionality over time turns into full-blown disease. So our goal is to keep you as far away from disease and pain zone as possible, as far away from dis-ease as possible, up here at the optimal health line for as many days of your life as is possible.